Well, I'll give you a couple from a book by Michael Tansey and Walter Burke called Empathy from Projective Identification to Empathy. Countertransference is the title of the book, From Projective Identification to Empathy. And I think their examples are very specific, and I'll just use them at the moment. What comes to mind is one example of a therapist whose patient had been observed by his father. The patient was on television and eager for his father to watch and to gain the father's approval. However, the father's reaction to the performance on television was to tell his son that he wasn't dressed correctly and his tie wasn't on right, something of that line. The son was enraged and furious at the father for somehow neglecting to pay attention to what he was saying and his achievement and focus on his dress. And so the therapist quite innocently said, well, did you talk to your father about it? At which point the patient blew up and said, talk to him about it. He's so rigid and narrow and argumentative. No, of course not. And then the patient sank into silence and stopped speaking. And at that point, the therapist became aware that there was a lot of anger in the room, and he was the target now. But he was also feeling that the patient then went right into a kind of excoriation of the therapist, saying the therapy was of no use to him, that he had wasted his money, that the therapist was running a scam game of some kind, and that if he had known better, he never would have started therapy. The therapist then this is part of his resolution of right before then he felt, I'm angry, I feel hurt, I feel this is unjust and unfair, and he also began to think, well, maybe he's right, maybe I haven't been the best therapist, but he was caught up himself in the welter of angry and also kind of self-accusatory feelings, and he could think of nothing to say for a while, and that was where they were stuck. He then had the thought, and this was where the impasse was somewhat resolved for the moment. He had the thought, I want to get out of here. I wish this session would end. I wish this guy would leave. I'd like to show him the door. And again, this is partly, and then he remembered that in the patient's tirade against his father, as his father was yelling at him over the phone for his poor dress habits, he remembered the patient saying to him, I just wanted the call to end. So at that moment, the therapist now put together two items that were not connected before. And they couldn't have been unless he had been able to review himself. And he realized, I want this to end just like the patient wanted that conversation to end with his father, which brought him to a very different attitude towards his patient. Rather than feeling angry and frustrated and defeated and in the midst of an impasse, he had light come to him, so to speak, and all of a sudden he recognized he and the patient shared an experience, and he began to think this was really maybe an unconscious purpose of the patient to show him what it felt like to be in the grips of an angry man who was disapproving and highly critical. And so he communicated something along those lines to the patient. But what he said was that he began, as he recognized that, he loosened up. He was no longer angry at the patient. And not only that, he felt very good about this discovery. And he began to realize what had ignited the patient initially was his saying, have you talked to your father about it? And the patient, he said all of that to the patient, who said, well, I thought you thought I was a wimp for not talking to my father about it. So it made me angry and disappointed and discouraged. Again, I'm elaborating a bit on the vignette. And when he realized, but you said that, and what I noticed is you're not mad at me. Well, that allowed the therapy to go forward. So that was a very powerful example of a way to get to an understanding of the patient without having to beat them up. But it took an enormous amount of self-observation. And that's a kind of example of a process that it went minute by minute as the therapist allowed himself to feel the rage and hurt and anger that he had to feel. But then he emerged from it with other thoughts about it. And it was the emergence of these other thoughts, a second set of thoughts, that allowed him then to kind of reflect more about what was going on until he came across this funny, quotes, coincidence of he and the patient sharing something. And so that's what does solve impasses, and that's one example, I think, of what a therapist is struggling with when they feel frustrated by a patient, attacked by a patient. Sometimes when they feel the patient is missing appointments, they can feel, of course, very injured and hurt, and they want to somehow force the patient to explain themselves, and the patient grows more defensive. And so then it is, how does one address issues where there seems to be a block in the relationship? How does one bring it up? And you're bringing it up with someone who's not an expert or not open necessarily to discussing it. Frequently, these people have never had experiences of impasses getting resolved. The fight goes on. They never kind of give it up, and no one ever helps them give it up. So you're entering into some territory frequently with patients when one does try to calmly listen as best one can, recognize one's own reactions, and then begin to just see what it might mean. But all the while keeping an eye on the patient's mood and readiness and receptivity. So it is very challenging because one can be in the throes of a strong reaction. This is what many examples would display. And one's questions would have a provocative edge. An example by Donnell Stern was of a patient a female patient he was working with, who complained about her relationships with men and men who were somewhat rejecting of her. And she presented somewhat of a victimized position. And I remember in the vignette, Stern had a certain recognition that this would go on, and I think he began to feel that his interventions were met with by her as she couldn't use them. He would say, well, why don't we think about that, or maybe we can reflect on it, and the patient seemed to feel hopeless. And at some point, she said something to him in a kind of apologetic tone. I guess I can't do what you're asking me to do. And at that point, he discovered something that came out of, I think, his investment in learning, which was, she's apologizing to me. She must feel then that I am kind of demanding something of her that she can't perform. And when he got that understanding, his attitude towards her changed. Rather than being a stubborn, shallow patient, she became someone who was communicating something with some richness to him. And that allowed him then to begin to address the nature of how she was experiencing him in these contexts. This allowed the patient, I think, to feel heard finally, to feel that something about the nature of that relationship, where he was the demanding therapist, albeit not consciously so, and she was a victimized patient. And it was the same issue she was struggling with men. So this was a very, again, from his own introspective capacities and his ability to kind of register and then work through his own reactions to say something that had an attitude of acceptance towards her, of the immediate experience, which then allowed her to feel less under the gun.